Welcome to Science Exposed, where we unpack cutting-edge research.
And dive deep into the science that shapes our world.
This deep dive is brought to you by the brilliant Dr. Cameron Jones,
Who handpicks each fascinating topic.
that we explore.
And today we're tackling a subject that's generating a lot of buzz.
The potential of cannabis in managing inflammatory bowel disease, or IBD.
You know,
When I first heard about this,
I have to admit, I pictured someone with Crohn's.
just lighting up a joint.
It turns out,
The science is a lot more nuanced than that.
really is. Before we even get to cannabis, though,
Let's make sure we're all on the same page about IBD.
while many people are familiar with the term,
It can be helpful to understand just how widespread and debilitating.
this condition is
Millions of people
around the world,
are struggling with chronic inflammation in their digestive tract,
facing a whole cascade of symptoms,
from persistent diarrhea and abdominal pain.
to fatigue and even weight loss.
It's definitely not just a minor tummy ache.
And it's not just one condition either, right?
There are different types of IBD.
That's right. The two main categories are Crohn's disease, which can affect any part of the digestive tract,
From mouth to anus.
and ulcerative colitis, which focuses its inflammatory attack on the colon's lining,
So two distinct forms of IBD,
each presenting unique challenges
which makes me wonder how they might respond differently,
to various treatment approaches.
including perhaps cannabis.
But before we get ahead of ourselves,
Managing IBD already involves a pretty diverse toolkit, right?
absolutely, it's not a one-size-fits-all situation. You've got your pharmacological treatments like anti-inflammatories and immunosuppressants.
Sometimes biologics that target specific parts of the immune system are used
And in certain cases, surgery may be necessary.
to remove damaged sections of the bowel,
Then there are complementary therapies,
focusing on lifestyle changes.
diet stress reduction techniques, and so on.
Managing IBD often comes down to finding the right combination that works for each individual.
Okay, so with this complex landscape of IBD management in mind,
Let's bring cannabis into the equation.
you sent over a research article published just last month on Curious that dives into this very topic.
What's fascinating here is how cannabis actually interacts with our bodies, especially when it comes to something like inflammation.
This is where the endocannabinoid system, or ECS, comes in. It's this incredible network of receptors and neurotransmitters found throughout our bodies.
In the brain, immune system, digestive tract.
Everywhere.
And it's involved in regulating a whole host of functions. Think mood, sleep, appetite, pain perception.
And critically for our discussion, inflammation.
So cannabis taps into this ECS.
And can potentially influence all these processes.
Exactly. The primary active compounds in cannabis, CBD and THC, interact with those receptors in the ECS,
CBD and THC.
the dynamic duo. But aren't they quite different?
I mean, THC is what gets you high, right?
Right. THC is the one primarily responsible for the psychoactive effects
But CBD, on the other hand, is non-psychoactive.
and has been gaining a lot of attention for its potential therapeutic benefits.
Okay, so when we talk about cannabis and IBD, are we considering both CBD and THC?
Potentially both. The Curious article highlights studies investigating the effects of THC, CBD, and even combinations of the two on IBD.
Interesting.
So what types of studies are we talking about?
And what are the key takeaways so far
Is there evidence that cannabis can truly make a difference?
for people with IBD?
Researchers have employed both observational studies, where they analyze patterns in people already using cannabis,
And placebo-controlled trials.
which provide a more direct comparison by randomly assigning participants to receive either cannabis or placebo.
That's good to hear.
It's important to have those rigorous placebo-controlled trials, so we're not just relying on anecdotal evidence. What have these studies revealed about the potential of cannabis in managing IBD?
Well, there's a growing body of evidence suggesting that cannabis, particularly THC, can improve symptoms like abdominal pain and diarrhea.
Even enhancing overall quality of life for some individuals with IBD,
That's encouraging.
especially for folks who are struggling with those debilitating symptoms. But is there any indication that cannabis can actually address the root cause of IBD, the inflammation itself?
That's the million-dollar question.
Some studies have actually shown promising results in terms of clinical remission, particularly with THC.
But we definitely need larger, longer-term studies.
To confirm these findings and really understand the mechanisms involved.
So while it's not a cure just yet,
It could be a valuable tool for managing symptoms and improving quality of life.
but you mentioned that most of the promising results have been with THC.
What about CBD? Is it showing any potential in this area?
The research on CBD for IBD is still developing, and the results are more mixed. This Curious article highlights a few studies by a researcher named Naftali, who has been quite prominent in this field.
One of his earlier studies from 2011, a retrospective study looking at 30 patients with Crohn's disease.
Found that THC significantly decreased the Harvey-Bradshaw index, a common measure of disease severity.
So people using THC were experiencing a noticeable reduction in their symptoms.
That's what the data suggests. Then in 2013, Naftali and his team conducted a randomized controlled trial comparing THC to a placebo in patients with Crohn's.
Now, that's the gold standard in research.
Yeah.
What did they find in that more controlled setting?
It was pretty remarkable. A higher percentage of patients in the THC group achieved clinical remission compared to those receiving the placebo.
But here's where things get interesting.
A later trial in 2017 focused on CBD.
But didn't find a significant difference in disease activity compared to the placebo.
That is interesting.
So THC seems to be taking the lead in the research so far.
But I'm guessing it's not that simple.
You're absolutely right. It's still early days, and we can't draw definitive conclusions based on a handful of studies. The dosages, methods of administration, and individual patient factors can all play a role in the outcomes.
Okay, so while the early findings with THC are encouraging, we need to keep in mind that individual responses to cannabis can vary widely and further research is critical. But there's another big question that comes to mind when we talk about using cannabis for medical purposes. What about safety?
That's a crucial question, and we'll dive into that more in part 2 of our deep dive. But first...
Okay, hold on. We promised our listener a seamless deep dive, remember? Let's just keep going. We're on a roll.
All right, you're right. Let's keep this momentum going. We were just about to dive into the safety aspects of cannabis use.
Especially for people who are already dealing with the challenges of IBD.
Excellent point. It's essential to differentiate between recreational and medicinal cannabis use. We know that recreational use,
especially long-term heavy use,
has been linked to some potential risks,
like cognitive impairments,
mental health concerns, and respiratory issues.
Definitely not something to take lightly.
But what about the research on medicinal cannabis for IBD? Is there a different story there?
The studies we've discussed using controlled settings and specific dosages of cannabis haven't reported any serious adverse events. The most common side effects mentioned were things like
dry mouth,
dizziness, and some mild cognitive impairments,
which tended to be temporary and manageable.
Okay, this is nothing too concerning in the short term.
But does that mean it's a free pass? Are there any long-term risks associated with medicinal cannabis use for IBD?
That's where the research gets a bit murky. Many of these studies have had relatively short follow-up periods, making it difficult to draw any firm conclusions about long-term safety.
Think of it like this.
We've only explored the tip of the iceberg.
And there's a lot more we need to uncover about the potential long-term effects, both good and bad.
It sounds like the scientific jury is still out on that one.
Which makes sense. Cannabis research is still relatively young, especially in the context of specific conditions like IBD. But speaking of ongoing research, let's shift gears and talk about the future. What are the frontiers scientists are exploring when it comes to cannabis and IBD?
One area that's generating a lot of excitement is the idea of personalized cannabis therapies.
You've probably heard about personalized medicine, where treatments are tailored to each individual's unique needs and characteristics.
Yeah, it seems like that's the direction a lot of areas of medicine are heading.
More targeted, more individualized treatment approaches. But what makes IBD a good candidate for this personalized approach with cannabis?
Well, remember those two main types of IBD we talked about, Crohn's disease and ulcerative colitis? Emerging research suggests that different cannabinoids might have varying effects depending on the specific type of IBD.
So what works for one person with Crohn's might not work for someone else with ulcerative colitis, or vice versa.
Exactly. For example, some studies hint that THC might be more effective for Crohn's,
while CBD could be a better fit for ulcerative colitis.
Wow, that's really intriguing.
So personalizing the therapy might involve figuring out which cannabinoid or combination of cannabinoids is best suited for each person based on their specific type of IBD. Is that what researchers are working on now?
That's a big part of it. But it goes beyond just the type of IBD. Personalized therapies could also consider factors like an individual's sensitivity to THC,
how they prefer to take cannabis,
even their genetic predisposition to certain side effects.
So it's like creating a custom-made cannabis treatment plan tailored to each person's unique needs.
Precisely. And this isn't just some far-off futuristic concept. Researchers are actively working on identifying biomarkers and genetic profiles
that can help predict how someone will respond to different cannabis-based therapies.
That's incredible.
It sounds like we're moving away from trial and error and toward a much more precise and predictive approach to using cannabis for IBD. Are there any examples of how this personalized approach is being explored right now?
Well, you mentioned Epidiolex earlier, the FDA-approved medication containing CBD that's used to treat seizures.
That's a great example of how cannabis-derived medications are starting to gain traction in mainstream medicine.
It shows that we're moving beyond the stigma and recognizing the therapeutic potential of cannabis.
Are there any other examples specific to IBD or conditions with similar inflammatory components?
This curious article mentions another interesting medication called Sativex. It's a combination of THC and CBD that's been approved in several countries
Though not yet in the U.S.
for treating symptoms of multiple sclerosis and cancer pain.
So already we're seeing cannabis-based medications being used for a range of conditions. But what's particularly interesting about Sativex?
Well, for when it's administered as an oral spray, which offers a different way to take cannabis besides smoking or eating edibles.
Right. It seems like the method of delivery can make a big difference in how cannabis affects you.
And how quickly you feel those effects.
Exactly. And that's another area where personalization comes into play.
Figuring out the optimal way to administer cannabis
Whether it's smoking, vaping edibles, oils, or sprays.
can significantly impact how well the therapy works for a particular individual.
So personalized formulations, personalized dosages, personalized methods of administration. It sounds like a whole new world of possibilities is opening up with cannabis and IBD. But there's a question that comes to mind. As exciting as all this sounds, if personalized cannabis therapies do become the norm, how do we make sure everyone has access to them? It seems like personalized medicine can be pretty expensive and out of reach for a lot of people.
That's a critical point. It's one thing to develop these amazing therapies, but it's another to make sure they're available to everyone who needs them. And that brings us back to the legal and regulatory landscape surrounding cannabis.
Right. The legal status of cannabis varies widely from place to place, and that can create all sorts of obstacles, both for research and for people seeking access to treatment.
Absolutely. For
Yeah.
example, even in places where medical cannabis is legal, insurance often doesn't cover it, which can make these therapies incredibly expensive. And that's where advocacy and policy changes come in.
We need to start thinking about cannabis as legitimate medical treatment and work towards ensuring insurance coverage for cannabis-based therapies, just like any other prescribed medication.
I completely agree. It's about leveling the playing field so that everyone can benefit from these advancements, regardless of their financial situation.
And it's not just about insurance coverage. We also need to address the issue of affordability in general. Even with insurance, some cannabis therapies can be quite costly.
That's true. So we need to explore ways to make these therapies more accessible financially, whether it's through government subsidies, price regulations, or even supporting research into more cost-effective methods of production.
It's about making sure these treatments are available to everyone who could benefit, not just those who can afford it. It's about equity and access, which are so important in healthcare.
Absolutely. And let's not forget about the ongoing need for research. As we delve deeper into the complexities of cannabis and IBD, we might discover even more effective and affordable treatment options.
So ongoing research is critical, not just for expanding our understanding of cannabis's potential, but also for developing new and innovative therapies that are accessible to all.
Exactly. And this research needs to be conducted ethically and rigorously with a strong focus on long-term outcomes and patient safety.
It sounds like it's going to take a multi-pronged approach. We need healthcare providers who are knowledgeable about cannabis and can have open conversations with their patients. We need patients who are empowered to make informed decisions and advocate for their own health. We need policymakers who are willing to update regulations and create policies that support access and affordability. And, of course, we need researchers who are continuing to explore the science and develop innovative therapies.
It's a collective effort, a paradigm shift in how we think about healthcare and the potential role that cannabis can play. And we're only just beginning to scratch the surface.
This deep dive has been fascinating, but it's clear that there's still so much more to uncover about cannabis and its therapeutic potential, especially when it comes to complex conditions like IBD. But as we wrap up this part of our conversation, I think it's important to remember that behind all the science and research are real people who are struggling with this condition. People who are looking for relief, for hope, for a better quality of life.
You're absolutely right. And their stories, their experiences should be at the heart of everything we do.
So as we move into the final part of our deep dive, let's hold on to that thought. Let's keep those individuals in mind as we explore how we can best integrate this knowledge about cannabis into real-world solutions for people living with IBD. Stick with us for part 3, where we'll delve into the practical aspects of integrating cannabis therapies into existing healthcare systems.
Welcome back to Science Exposed, where we've been unpacking
The fascinating world of cannabis and its potential role in managing inflammatory bowel disease.
or IBD.
In the previous parts, we explored the science behind cannabis's interaction with our bodies, the promising, albeit early research on its effectiveness for managing IBD symptoms,
And even delved into.
the exciting future of personalized cannabis therapies. But now let's tackle the practical side of things.
It's all well and good to talk about groundbreaking research and potential treatments, but if those treatments aren't accessible or integrated into existing healthcare systems,
They won't make much of a difference for the millions of people.
living with IBD.
Right, it's about bridging that gap between scientific advancement and real-world solutions.
We left off talking about ensuring equitable access to cannabis therapies, but what does that look like in practice?
One of the biggest hurdles.
Is ensuring that healthcare providers are well informed about the potential benefits and risks of cannabis for IBD.
Because let's face it, there's still a lot of stigma and misinformation surrounding cannabis.
Even seasoned medical professionals.
May have outdated or inaccurate views.
Absolutely. Many healthcare providers may feel uncomfortable discussing cannabis with their patients, or they simply may not have access to the latest evidence-based information
to guide their recommendations.
So how do we bridge that knowledge gap? It sounds like education and training are key.
Exactly. Medical schools need to incorporate comprehensive education on cannabis and its therapeutic potential into their curricula.
Professional organizations need to provide continuing education opportunities for practicing physicians and nurses. Even government agencies could play a role in disseminating accurate and up-to-date information to healthcare professionals.
It's about equipping healthcare providers with the knowledge and resources they need to have informed conversations with their patients about cannabis.
Precisely. But it's not just about educating doctors and nurses. Patients also need access to reliable and accurate information so they can actively participate in those conversations and make informed decisions about their healthcare.
That's a good point. With all the information and misinformation swirling around online, it can be tough to separate fact from fiction.
It really is. There's a lot of anecdotal information, marketing hype, and even outright falsehoods out there. It's crucial for people with IBD to have access to evidence-based resources, clear guidelines, and opportunities to discuss their concerns and questions openly with their healthcare providers.
It sounds like it's a two-way street.
Healthcare providers need to be educated,
Yep.
and patients need access to reliable information so they can have these productive conversations about cannabis and IBD.
Absolutely. And those conversations are vital because at the end of the day,
Personalized medicine is all about finding the right treatment for each individual.
right, taking into account their preferences, their concerns, their medical history, all those individual factors that make us unique.
Exactly. And cannabis is no different.
A personalized cannabis therapy for IBD might look very different for one person compared to another,
So for some, a high THC oil might be beneficial,
while others might find relief with a CBD-dominant strain.
and the method of administration could also vary,
Edibles might work well for one person,
while another might prefer vaping or even transdermal patches.
and those choices, those personalized decisions about cannabis therapy should be made through open and honest discussions between the patient and their healthcare provider.
Absolutely. But there's another big piece of the puzzle we need to address. How will this integration of cannabis into healthcare systems impact insurance coverage and affordability?
Right, that's a huge question. In many places, insurance doesn't cover medical cannabis, which can make these therapies prohibitively expensive for many people.
It's a significant barrier to access. If we're serious about equity and ensuring that everyone who could benefit from cannabis therapies can access them, we need to tackle the issue of insurance coverage head-on.
It seems like we need a shift in how we view cannabis.
Yeah,
We need to start recognizing it as a legitimate medical treatment, not just something recreational.
I agree. We need to advocate for policies that ensure insurance coverage for cannabis-based therapies, just like any other prescribed medication.
It's about leveling the playing field so that cost doesn't become an insurmountable barrier to accessing potentially life-changing treatments.
And it's not just about insurance. We also need to consider the overall affordability of these therapies.
Because even with insurance coverage, some cannabis therapies can still be quite expensive.
You're right. That's why we need to explore various avenues for making these therapies more financially accessible. Perhaps it's through government subsidies or price regulations, or maybe it's investing in research to develop more cost-effective methods of cannabis production.
It's about making sure these treatments are within reach for everyone who needs them, not just a select few.
And let's not lose sight of the critical role of ongoing research. As we continue to learn more about the complexities of cannabis and IBD, we might discover even more effective, safer, and affordable treatment options.
So continued research is vital, both for advancing our scientific understanding and for developing new and innovative therapies that are accessible to all.
Exactly. This research needs to be conducted with the highest ethical standards, a focus on rigorous methodology, and a commitment to long-term patient outcomes and safety.
It sounds like it will take a massive collaborative effort to successfully integrate cannabis therapies into healthcare systems in a way that benefits everyone. Healthcare providers, patients, policymakers, researchers, even the general public all have a role to play.
It's about changing mindsets, challenging outdated perceptions, and embracing a new era in healthcare where personalized therapies and plant-based medicines like cannabis are given the recognition they deserve.
This deep dive has been an incredible journey of exploration, and it's clear that we're just at the beginning of understanding the potential of cannabis in medicine,
We've uncovered fascinating insights, challenged assumptions.
and hopefully spark some curiosity and new perspectives.
And as we wrap up this conversation, let's not forget the human element. Behind all the research and scientific discussions are real people living with the daily realities of IBD.
Individuals who are seeking relief, hoping for a better quality of life, and looking to the future with a sense of possibility.
And it's their stories, their experiences, their resilience that should inspire us to keep pushing forward, to keep exploring, to keep advocating for better treatments and a brighter future for everyone affected by IBD. Thank you for joining us on this deep dive into the world of cannabis and IBD. We encourage you to explore the additional resources and ways to connect with Science Exposed in our show notes. And don't forget to like, share, and subscribe to stay up to date on the latest scientific discoveries. Until next time, stay curious.